Assalamu alaikum everyone and welcome to Ordinary Days. In this video, we are going to begin with oral cavity, and this whole playlist is going to feature all the contents of oral cavity. First of all, you should know what is oral cavity. So this oral cavity or mouth is the region which is bounded anteriorly by our lips, superiorly or its roof side by the hard palate and the soft palate. Then posteriorly, this mouth is going to open into the oropharynx, and inferiorly or in the down portion you have your tongue. So in this whole playlist we are going to talk about the two types of palate that form the roof of the oral cavity, the lips that form the anterior boundary, the cheeks that form both the sides. you know you can see it over here. This is the whole thing, and these sides, both of these are cheeks, and this anterior portion is going to be your lips, and posteriorly it is going to open into oropharynx, which is a muscular part of the pharynx. Now also this whole oral cavity is going to communicate superiorly with the nasal cavity, because what is above your mouth, it is your nose, and it is going to communicate inferiorly with the larynx, which is also the portion of your a part of your respiratory passageway, etc., the part which is associated with vocalization. Now it majorly involves the contents, which is main organ is the tongue, which is forming the floor of the oral cavity, and divisions of the oral cavity are the vestibule and the oral cavity proper. Now how do we define the vestibule and how do we define the oral cavity proper? So vestibule is the region that is between the lips anteriorly and the gums and teeth posteriorly. So if you clench your teeth, the portion between your teeth and gums and your lips anteriorly, that portion is going to be your vestibule. That vestibule has boundaries. Externally it is bounded by lips and cheeks, whereas internally it is bounded by gum and teeth. And the portion which is going to be posterior to your gums and teeth, that is the whole larger part of your oral cavity, that is going to be the oral cavity proper. But anything that is external to the teeth and gum, that is going to be your vestibular portion of oral cavity. Now communications, as you know, exteriorly how you are going to communicate, how the vestibule is going to communicate with the exterior, through the fissure between the lips, because it has external boundaries of lips, and the fissure between the lips is known as the oral fissure. That is the portion through which we throw things into our mouth. And the interior portion, as you know, on the interior side you have your gum, you have your teeth. So how does the oral cavity, or sorry, the vestibule communicate with the oral cavity proper? When the teeth and gum, they are close together, the communication is going to be behind the third molar tooth. But when the mouth is open, like if you have your teeth open, then oral cavity and vestibule are connected freely. But when you have your mouth closed, then the communication is via the crown or the behind the third molar tooth. Now we will see about the openings. First opening in the vestibular region is parotid duct. Then we have labial and buccal folds, labial and buccal glands, and then we have molar glands. First is parotid duct. The parotid duct is going to open on the inner surface of the cheek, opposite the crown of second molar tooth. I have a diagram to show this to you. So this parotid duct is going to open opposite the crown of second molar tooth. This is your second molar tooth, and opposite the crown of upper second molar tooth you have this opening of parotid duct in the vestibule of the mouth. Then we have labial and buccal glands. Labial glands, labium is your lips, buccal is your cheeks. So labial and buccal glands, they are situated in the submucosal region of lips and cheek, and they are mucus glands. And molar glands, they are also mucus gland. They are 5 in number, and they are situated in the buccopharyngeal fascia of the molar tooth. Lining. Whole of your oral cavity, it is lined by, or the vestibular region, it is lined by mucous membrane, except the teeth, because the teeth are there lined by enamel and not by mucous membrane. Now these mucous membrane form a folds in the median region, and these folds that grow from the lips to your gums, they are known as frenulum of the lips. When the frenula are two in number, they are known as frenula, but when it is one in number, it is known as frenulum. And clinical correlations: parotid duct papillae, they provide access to the parotid duct, and whenever there is this opening of the parotid duct, it is going to help you to inject radio opaque dyes into your parotid duct, and that will help to locate calculi in the duct or in the parotid gland. So that opening of the parotid duct, which is opposite the crown of upper second molar tooth, that is very important for radio opaque dye injections to find out the calculi in the duct and gland. Then we have measles. Measles is a disease, and how do you diagnose it? You are going to ask the patient to open their mouth, and you are going to check the region of upper second molar tooth, and if the opening, that is of the parotid duct, it is surrounded by white spots that are known as copic spots. If those spots are found, then it is confirmed that the person has measles. With that, we are done with all the uh, histology, anatomy, everything related to the vestibule. In the next video, we will talk about the lips.